Welcome to the Physicians Committee's Mission Critical Update with Dr. Neil Barnard. And thank you for joining us today. It's already December 18th, 2020. I'm Betsy Wasson, PCRM's Vice President of Development, and we're so glad that you're joining us. This is the final Mission Critical for 2020. And today we've got something extra special for you. Dr. Barnard is going to recap a very busy year. We've had surprises, we've had new challenges, and we've had a lot of victories. And this pandemic did not slow down the Physicians Committee. In fact, you'll hear from Dr. Barnard how we ramped up and added programming to address the health and animal cruelty issues that COVID-19 brought with it. So, and it was, and it is, all made possible through your support. So you may have joined us for our 35th anniversary event earlier this month when we launched our matching gift campaign. So when you make a donation between now and the end of the year, it will be doubled. And you can imagine how much we can make happen for animals and people when we double your donation. So just go to our homepage and look for the big donate button. It's at PCRM.org. And you'll see the big button there to make a secure donation. And if you'd rather call us, please do. We would love to talk with you. The number is 202-527-7304. And when you call, you'll be connected to Jeanette or another one of our staff members who can take your donation, answer any questions that you have. I'll put that number in the chat a little bit later on. So you have until December 31st to have your donation matched, but why wait when you can have it doubled today and start your donation working right now to make a big difference. So thank you so much. We have the chat box going already, and please go ahead and chat away. Let us know that you're here and where you're joining us from. And when you choose all attendees and panelists from the drop-down menu, that means we'll all be able to see each other's messages. So now let me turn this event over to the president and founder of the Physicians Committee, Dr. Neil Barnard, for a mission critical update.
Thank you, Betsy. And thanks to all of you for joining us. It's wonderful to see in the chat how many people are jumping in and saying hi. If you haven't yet had a chance to do that, please do. Please jump in the chat. Let us know where you're watching from. We actually do look at this, and it's so nice to see folks who have joined us week after week. And it's also really cool to see people who are new to the PCRM family. Whether you've been with us for a long time or brand new, welcome. Delighted to have you. And as Betsy mentioned, I'd like to talk about what this year has brought us. It has brought challenges, and it's brought a lot of victories, and it's also taught us a number of things that we're going to continue to use in the future. And let's just jump in. I want to share a number of things with you. Starting with COVID, I don't need to tell you that COVID has been just a dominant thing. And it started, as we all know, with live animal markets in China. And when people were selling bats and eating bats, and the viruses from the bats would enter the human population, a pandemic could get started. And so we have been working very hard to make sure that people understand that, but we have to go further, and that is we have to ban these live animal markets. Now, this was a huge thing at the beginning of the pandemic, but then what happened? Everyone went to sleep. And the live animal markets are still going strong in China. And in New York City alone, there are about 80 operating live animal markets where a virus can come in, infect one animal, pass to other species, and become more virulent, more pathogenic, and can infect you. We need to have these banned, and at the Physicians Committee, one of the first things we did was to introduce a ban on live animal markets in the New York State Legislature. It is there in Albany right now. And COVID has really kind of put the whole legislative calendar into a bit of turmoil. But the bill is there, and it's going to come up in the new year. And if you're in New York or know somebody who is, we really need your support. We need to end these live animal markets once and for all. They're cruel, they're unhygienic, and they are exactly the breeding ground for a pandemic. Okay, And it's not just that. It's not just the live animal markets. It's also the slaughterhouses. You know, if you walk into a slaughterhouse, you're going to walk out as a vegetarian. When you see the hideous conditions and what it takes to turn a beautiful animal into a food product wrapped in plastic, it's really grotesque. But the slaughterhouse workers, because they're shoulder to shoulder, working with these products, have been, the slaughterhouse workers have been at incredibly high risk for COVID as well, including many, many deaths. And we have been publicizing that with demonstrations at Smithfield and all sorts of slaughterhouses around the country, getting press along the way, so that people who suddenly thought, well, you know, they had thought that a pork chop was an okay thing, will start to think differently. And this year we have turned to new ways to reaching you and other people. This is Chuck Carroll and me. And we had the Exam Room before, which was Chuck's fantastic podcast, which by the way, if you have not listened to it, you really must. If you have listened to Exam Room, you know how fantastic it is. Well, Chuck said, let's do the Exam Room live and let's do it every single day. And that's what we have been doing, 12 o'clock Eastern time. In fact, we just did it today. And those of you who have joined us, it's been a great way for us to keep in touch, but also spread messages about COVID, about prevention, about surviving, and about changing this world that we live in. And I have to say, one of the real highlights for me of this year came out of necessity. I'm speaking to you right now from Washington, D.C. And here in Washington, our city demographically, 46% white, 46% black, smaller numbers of Latinos and people of Asian heritage. But when we look at the death rates, 3 out of 4 have been among Black Washingtonians. And it's not just true here, it's been true in really throughout the country, particularly in urban areas. So we thought, what is this about? It's partly structural things, it's partly economic things, it's partly access to care, but it's also because there's so much diabetes disparity and an obesity disparity, which we can tackle with food. So we launched a program called Fight COVID with Food. We geo-targeted it through social media to people in the most economically disadvantaged areas, but also urban areas, and to people of color. And so many people jumped in. We almost overnight had 5,000 participants saying, I don't want to get COVID. I don't want to have the diabetes and obesity that makes COVID deadly. I want to fight COVID with food. And it has been just a fantastic program. I say it was, but it really is continuing into the new year. And many of you on this call have supported this program in particular because so many people from so many diverse communities are now embracing a plant-based diet and sharing it with their communities and their families. It's been wonderful to see. Okay, let me shift gears. We've been talking about getting the animals off our plates. Let's talk about getting animals off the table. I'm talking about the surgical table. So many surgeons historically would practice on a dog. The dog's not going to survive. Or they practice on a pig or a goat or a rabbit. Those animals don't survive. You can teach good surgical technique without ever using animals at all. In fact, the best surgeons in the country will tell you that the way to learn surgery is you start with simple things. Tying knots, which you do on styrofoam. Then you make the incision, maybe in an actual patient, but under the very close, watchful eye of the surgical team. And you learn all the various pieces of surgery and surgical technique as an apprentice. Now, sometimes you can back up and you practice on a cadaver, which is commonly done, a human cadaver. So the anatomy at least is right, not a dog where the anatomy is not what you need. And there are also synthetic models that can be used for certain things, so particularly like laparoscopy training. So this year, having already eliminated all use of animals in medical schools and osteopathy schools and pediatrics residencies, and pretty much in emergency medicine and in trauma, we started focusing on surgery. And it has been wonderful to see the Cleveland Clinic said, you are right. One of the most prestigious medical centers in the world said, we're not going to train our surgeons on animals. And the University of Michigan Spectrum Health, same story. University of Virginia, same story. Medical College of Georgia, same story. They turn out the best surgeons in the world. They don't train on an animal. They train in a way that is relevant to human biology, and I am quite confident that in the coming years, we will win at every single surgical program. That's thanks to you for helping us to get the word out far and wide. And we got great news also from the Environmental Protection Agency. We've been, well, frankly, we've been pushing the EPA for a really long time, but in the past several years, they have become a very good partner with us. And many of you remember last year, they announced that they were going to end the use of mammals in testing procedures. That takes some time, but this process has begun. And this year they got rid of the use of rabbit tests. You know, there's just about nobody cuter than a rabbit. And the idea that they would be tortured, poisoned, and ultimately killed to test a detergent or a pesticide. I mean, what a grotesque thought. There have been alternatives that have come up, and the EPA finally said this year, PCRM, you are right. Let's get rid of the rabbits. They're not needed in testing at all. And the rabbits are breathing a sigh of relief. All the other animals are right behind them. The EPA has made a definitive commitment to ultimately ending all mammalian tests. Okay, but it's gone far beyond that. This is Elizabeth Baker, who has worked here at PCRM for several years, and she has worked with the Food and Drug Administration. The FDA will say to you, our job is harder than the EPA. At the Environmental Protection Agency, we're trying to protect you from chemicals you might inhale accidentally. At the FDA, Food and Drug Administration, we need to protect you from chemicals that you're swallowing intentionally because it's a medicine or it's something in food. So the FDA has always said, testing here is a much bigger challenge. Well, that doesn't mean that animal tests are any more relevant. It doesn't mean that something that looks safe in a rat is going to be safe for you. There are dramatic species differences, and there are good ways of testing that allow us to leave the animals out and get good test results in. So Elizabeth has for years been working with the FDA on a new program, and the FDA just unveiled it now about 2 weeks ago. It's called the iStand, Innovative Science and Technology Approaches for New Drugs, iStand. And what they're going to do is they're going to say, okay, non-animal methods can come in. This program will evaluate them. And once they are approved, that means not only can you, manufacturer, use it, but anybody can use that test. So this isn't the end, this is the beginning, but we have finally opened the door. And in the same way as we've had huge progress with EPA, that's where we're going with FDA, which has historically been really tough, but it's been just a fantastic breakthrough just a couple of weeks ago. Okay, now there are still plenty of challenges left, and here's a huge one. Do you have a dog? Or did you have a dog? I know you had friends who had dogs. When you think about people being mistreating a dog or hurting them in any way, it's just an awful thing to do. But there are people who do this, calling themselves scientists, doing it deliberately. And some of the most just awful experiments have occurred in Michigan. You've heard us talk about it. Wayne State University. Dogs taken from shelters that didn't go into adoptive homes, went into a laboratory where they were operated on to weaken their heart. Then they were run on treadmills to see what would happen if a dog with a weakened heart, who had heart failure, could be exercised, and in some cases exercised to their deaths. We've spoken out strongly against this. It's still being funded. It is still going on now. We introduced a bill into the Michigan State Legislature that would ban painful experiments on dogs. But you know what? There are people fighting us. There are people who are involved in selling dogs for experiments. There are people who say, well, don't put any restrictions on what an experimenter can do behind closed doors. Well, I'm here to say that ethics is the foundation of any kind of medical progress and any kind of research progress, and this has to be banned. So I'm gonna need your help. I'll keep you posted in the new year about how you can help. And we've been really rallying here in Washington, D.C. Congress holds the purse strings for the National Institutes of Health. And so we had lots and lots and lots of our members just a couple of weeks ago call their members of Congress and their congressional offices. It was a virtual Hill Day, and it was so fantastic for those people who tend to be kind of quiet and well-behaved to be able to pick up the phone and let their members of Congress know that they want animals out of labs. So lots more to come. Also, there are many young scientists who don't want to be cruel to animals. They don't want to do animal experiments, but they're not sure about the non-animal methods. They need to learn about them, and we're here to teach them. So we have had new training programs for the young career scientists. And I have to say, we're not only going to be changing the minds of young scientists, we're going to be changing the way science is done overall. So we're super excited about that. Shifting gears again, we are really eager to find ways to help people to eat in a more healthful way. When they do, it's good for their heart. It's good for reducing cancer risk. It's good for tackling diabetes. And it's also not so bad for the animals. Americans right now eat 1 million animals every hour. And if you stop eating them in order to be healthy, the animals don't care why they're not being eaten. So we've had lots of innovative educational programs. And although Zoom can get kind of tedious for some people, for us, it has been a way to reach people all around the world, all simultaneously. We've had online plant-based immersions where people have joined us, and they really, in just a couple of hours' time, learned everything they need to know about following a healthy plant-based diet. And this is Joaquin Corral and Aurora Leon, who did all of this with us in Spanish, along with Ana Negron, who has been a PCRM member for decades and decades and decades, and really led the charge in this program and many others. So we can do it in English, we can do it in Spanish, and we can do it in Hindi. In India, there are so many people who, I'm sorry to say, are kind of going the wrong way. They're going from a wonderful vegetarian tradition now into trying to embrace this cheap American meat-eating diet. Well, we need to turn that around. And I'm happy to say there are more and more and more people saying, wait, let's go back to traditional Indian plant-based foods. And it's much more activity coming in the new year, but we're super excited to have planted so many seeds for the Indian subcontinent and also in China. And we've had many innovative programs for showing how foods can tackle hormonal issues, how they can tackle diabetes, and so many other things for lay people, also for doctors. You know it, I know it. Doctors are not necessarily right up to speed when it comes to nutrition. In fact, if you're a vegan, your doctor is probably as likely as anybody else to say, where do you get your protein? We're out to change that, and we have some continuing medical education programs that I want to tell you about, but one of the most exciting is this book, The Nutrition Guide for Clinicians. And the first edition was a book that could go right in a medical student's white coat pocket. And the second edition and the third edition was getting bigger and bigger and bigger. And we decided, yeah, a book is good, but an online resource is better, because now every medical student anywhere in the world can download it for free, and it's continuously updated. So a new study comes out showing the plant-based diet is good for congestive heart failure or end-stage renal disease. It goes in the nutrition guide. The medical students get an instant update on this, and they are kept up to date on plant-based nutrition. I wish we had this back when I was a medical student at the George Washington University. It was ignored. But thanks to your support, you've made this possible. We launched this program. It's being updated. Constantly, the medical students absolutely love it. And we have a conference that we've had every year, the International Conference on Nutrition in Medicine. And you know what? Hold on. I'm going to pause because I see the sun has just come out. I think I'm going to put my shade down so that we can talk. Sorry about that. Here in Washington, it has been gloomy and doomy, and finally the sun is coming out. Things are getting better. Okay, I was telling you about our International Conference on Nutrition in Medicine. We've had this every year. It would make your heart sing. Hundreds and hundreds of doctors all getting together. This is Dr. Kim Williams, the former president of the American College of Cardiology. And this year, because of the pandemic, we didn't want to stop the conference. We wanted to go virtual. We did, and it has been huge. And it's allowed us to do two things. It's allowed speakers who couldn't come to Washington because they were in Thailand and they had other things that they had to do. It's allowed those speakers to join us. And it's allowed participants to come from anywhere in the world. And we're really super excited about what this technology has allowed us to do. We also have free continuing medical education up until now. Doctors thought, CME, I need continuing medical education to keep my license. And they go online and it's all fueled by the pharmaceutical industry. Well, the Physicians Committee, in partnership with the George Washington University and approved by the American Medical Association, offers hours and hours and hours of CME for physicians, for nurses, for dietitians, for physician assistants. And you've made all of that possible. It's really changing the world. And it's not just doctors, it's lay people who need it too. October, we launched the second year of the Let's Beat Breast Cancer campaign. I really want to tip my hat to Dr. Christy Funk. She's a wonderful breast cancer surgeon. But just like last year, this year, she went on Good Morning America and launched the program. And you saw her probably on The Doctors. She was on Rachel Ray. It got to the point you couldn't turn on the TV without Dr. Christy Funk being there talking about reducing your risk for breast cancer with a plant-based diet and other healthy lifestyle changes. So it's been absolutely wonderful to see. And many, many celebrities have jumped in. Tracy and Jon Stewart, the Camerons, Hilaria Baldwin and Alec Baldwin, and so many others have joined us to spread the message. Okay, Barnard Medical Center. We were affected by the pandemic just like everybody else. We were already able to offer telemedicine, but this year we put it into high gear so that our doctors can see you. We're in Washington, you're in Los Angeles, we can see you for a medical appointment. And that's true if you're in Dallas, that's true if you're in Baltimore, that's true if you're in Brooklyn. Our doctors have been able to reach out more than ever before. So we certainly are glad to welcome people to our clinic, but we're also delighted to see you on your iPad. So don't be a stranger. Let me unshare and come back. And I just want to finish up and say, there is so much more that we are doing. And in many ways, we are really trying to sow the seeds for the future. A huge part of that, in some ways a very difficult part of that, is the clinical research that we do. A lot of people have the idea that research means experimenting on mice or experimenting on monkeys. For us, clinical research means understanding human biology, whether it's looking at human bloods and measuring cholesterol levels and measuring hormones in blood, or whether it's bringing people in and watching how a diet change can help them lose weight, how their diabetes can get better, how their pain can improve. We're doing all of these things. Why? Not just to show that research can be done in an ethical way, but to influence what doctors know and what policymakers know, so that they can see that a plant-based diet, a vegan diet, is not just safe and healthy, but has advantages over every other kind of diet that's out there. And about 2 weeks ago, the American Medical Association published a very huge study that we had done. It's 244 participants. We were looking at what a vegan diet does to your metabolism. And it was a partnership with the Department of Endocrinology at Yale University, where participants changed their diets here in Washington. They got on the Amtrak train. They went up to New Haven, and they went into the MR scanner, this magnetic resonance scanner, where our research partners were able to look inside their livers and look inside their muscles non-invasively and see the changes that the diet was causing over time in a very helpful way. And the American Medical Association published it. Why? Because what we showed is that a plant-based diet doesn't just help you lose weight. It starts tackling insulin resistance, which means it's a great diet for diabetes. It speeds up your metabolism, which means it's a way to allow permanent weight loss. And spin-offs from this study were published showing that it didn't matter if you were blood type O or blood type A. You know what I'm talking about, the blood type diet that people have said, well, maybe I can't do a vegan diet because I'm type O. Well, we were able to debunk that. We have a new paper coming out shortly that looks at different races. If some people may say, well, a vegan diet is good for this demographic group, but maybe not so good for that demographic group. Well, I think you'll be surprised at the research findings that are coming out in a couple of weeks. We put out a survey for all of those hospitals who said, we really need to serve bacon to keep our hospital patients happy. We put out a survey from 200 hospital patients here in Washington, D.C., that showed that hospital patients want the bacon out. They support the whole idea of a hospital being a healthy environment. We have many more studies coming in the new year. They're very exciting, and I can't wait to share the results with you to give you a sneak preview. We've done a head-to-head test of a Mediterranean diet versus a vegan diet. We're studying how foods affect a variety of hormones. Am I going to give you the results? Not until they're published, but stay tuned. These things are coming soon. Lastly, I just want to say that although I've been talking about a whole lot of progress, our challenges remain in front of us. And they're big. Whether it's to reform how research is done, or whether it's to get animals off the plates, whether it's to help human health, all of these require a huge team that executes its strategy as aggressively as possible. You've helped us do that, and I never forget that. And our team never forgets that. So thank you to you for making that all possible. And I look forward to lots more progress in 2021. Thanks for being with us. Back to you, Betsy.
Thank you, Dr. Barnard. Yeah, where is this sun coming from? The chat is so fun to see, and I see that we have Mindy Kurzban, our board chair, joining us today. Mindy, thank you for all you do. And we have different countries represented, which really kind of hits home that this is a global movement. We've got Shirley Ann and Geraldine from Canada, and Rolene from Luxembourg, and Sandra from the UK, Wendy from Germany. Thank you so much for joining us and for supporting this work. We see a lot of familiar names with us today, and I see a lot of new names too. So welcome to the PCRM family. And Kimberly wants the recipe to the tostadas that were shown in one of Dr. Barnard's slides. And so I would say that there are recipes galore, including the tostadas that you can find on our website. And if you go to the home page and type in recipes to the search bar, you'll be amazed at what comes up. And so enjoy that. It's the wrap up.
Wait, Betsy, I need to say a big hi. Dr. Ruth, that's Dr. Ruth Heydrich in Hawaii, just joined us. And if you don't mind, I'm just going to say a big hi to Dr. Ruth Heydrich. She has helped us so much to get the word out about breast cancer, because as a breast cancer survivor herself, who has modeled healthy eating and lived to show the beautiful results. Thank you, Dr. Heydrich. Thank you to you, and thanks to everybody else who jumped in. So, anyway, Betsy, back to you.
No, super. Well, I was just going to comment on your wrap up of the 2020 year and just the amazing things that have happened and the progress that we've made. But, you know, we're also emphasizing PCRM's 35th anniversary year. And Dr. Barnard, I would like to pose a question to you. This year, we've found so many ways to leverage our message even better, reach even more people. So as we've been celebrating PCRM's 35th anniversary, I wonder, in all those years leading PCRM, if there's a point where you kind of felt like you were really onto something, where you knew that change was just not possible, that it was really going to happen. And I mean, is there a personal highlight that stands out for you in PCRM's 35 years? I know that's kind of a big question, but.
Well, when we got started, I was straight out of medical training. I was working in New York, and I decided I wanted to do this. And I was hoping we might have 10 or 12 doctors who were willing to provide medical expertise, because there were groups out promoting vegetarian diets, there were groups out promoting alternatives to animal research, but they didn't have the clout that doctors had, and they might not have had the technical expertise that I thought we could bring. And at first it was a bit of a challenge to identify doctors who wanted to help. But more and more people did. Doctors like Ron Allison and Levon Painter and many others started to join in, which was wonderful, and Anna Negron and many others who started to join in. But one day, I was on a running, and I had a t-shirt that said the word vegan on it. And I happened to run into a guy who was standing there, and he said, "Oh, that's a great t-shirt you've got there, but I couldn't wear something like that in my profession." So, well, what's your profession? He said, well, I'm a doctor. I said,
Mm.
wait a minute, you're a doctor and you can't talk about healthy diets. And so we got to talking about the physicians committee. And he said, well, that's just great, but I'm not from here. I live in Vermont. And we got to talking, and it turned out that in his little town, he started telling me about the other doctors he knew. Many of them were PCRM members, but they just hadn't gotten together to talk about it and to share the fact that they were all going in the same direction together. So what this taught me was we're not one person, two people, six people, 12. We are thousands and thousands of people going in the right direction. Medical professionals, scientists of all kinds, and lay people and celebrities and people working together, numbering now into the millions who are changing this world. So when he told me that, when he made that statement to me, I started to reflect on exactly how far we've come.
Well, congratulations, and bigger and better things are ahead, you know, even though you've made so much progress over the past 35 years. I would like to thank those of you who have already donated and had your donations matched. I know many, many of you have, and you really are the kind of heartbeat of PCRM, keeping the blood pumping and making sure that we have the energy to do this work, the energy and the funding. And I wanted to mention again that your donations will be doubled now until the end of the year. And when you make a donation, your $20 will turn into $40. Your $50 will be $100. And you know, if you can afford to give even more than that, your donation will be matched to double its impact. So you can find a big friendly donation button at pcrm.org, or please call us 202-527-7304. And on behalf of PCRM, on behalf of all of us here, happy holidays. And we hope that you're able to celebrate with your loved ones, even if it's by phone or by Zoom. And we'll see you next year for Mission Critical on January 8th. And I'm sure by then we'll have a lot more to share with you. So thank you and happy holidays.